What I was going to do is take a quick look at the assessment of the Achilles tendon before we start to look at more the treatment modalities. More accurate assessment and diagnosis will pertain as to what's going to be the best mode of treatment. Well, the main assessment is palpation. So palpation is going to tell you quite a lot about what state the Achilles tendon's in. So if we start with regards to determine whether it's the tendon or the actual tendon sheath, and again to determine whether it's insertional or whether it's in the mid portion of the actual tendon itself. So if we start down at the calcaneum and we can start to palpate around the calcaneum just to determine as to whether it's the bursa that's actually affected or whether it's an insertional Achilles tendinopathy. Start to come up from that, and then we're going to get into the lower 1 centimetre of the tendon. Most Achilles tendinopathy is going to be in 2 centimetres to 6 centimetres within this section here. So we start to palpate into that region and find the most tender point. What's going to be important is you also need to determine as to whether the tenderness is on the medial or the lateral side. So the best thing to do is to block the lateral side with the thelma eminence of the part of the thumb. And then what you're going to mainly do is to palpate down the medial side to see where the tenderness is along that side. Then what you're going to do is to do the same to the other side and then palpate along the lateral side. Now, whichever side's most tender is going to determine as to which side you're going to focus more of your attention when it actually comes to the treatment of the Achilles tendon. Same again is to come right the way up the actual tendon, right to the musculotendinous junction of the gastroc-soleus, and determine as to whether there's any tenderness there. In this particular section here, this is one of your important acupuncture point is urinary bladder 57, which is a common point which you will utilise for Achilles tendinopathy, but to see whether there's any tenderness within here. Also come in a little bit further up, and where you've got the highest part of the gastroc is going to be urinary bladder 56. This is also a trigger point for the Achilles tendon, and what you're going to basically find is this trigger point here will refer pain directly over the Achilles tendon. So you do need to make sure that this trigger point isn't active, otherwise it's going to start to cause tightness and tenderness directly over the Achilles tendon. You have also got trigger points in the soleus muscle, so you do need to come up and determine as to down the side of the soleus as to whether there's any tenderness down here or down these sides here. These will sensitize the heel and make the heel very sensitive to any kind of touch or anything that's actually resting on it. So if those trigger points are active, it will actually start to make that very, very sensitive. So you do need to rule that out. Make sure you palpate the gastroc generally for any muscle tears or any sensitivities or tightness within the gastroc-soleus complex. So you do need to actually make sure there's no tears, because if there's any minor tears in here, once the person's standing or active, gravity is going to take any accumulation of swelling down to the Achilles, and that can present itself as Achilles tendinopathy when the main problem is actually further up in the actual calf muscle in itself. Make sure you've not got any posterior tibialis tendinopathy or they haven't got any peroneal tendinopathy, because that can also refer pain into this region. So you do need to do a detailed assessment in order to rule that out. Also check the soleal nerve to make sure that you haven't got any neuritis in that, because again it can refer pain into that region. The other test you can actually do is what you call the squeeze test. This is just to make sure there isn't actually any ruptures, partial or full ruptures of the actual calf muscle. I mean, in most cases the way the person will walk in will determine as to whether there is a rupture of the calf, but just simple squeeze test is to get into the belly of the muscle and just squeeze, and as you notice the foot will actually plantarflex as you actually squeeze the muscle. If you don't get any motion there, or plantar flexion, then that's going to indicate that there is a possible tear within the muscle. Obviously, you're going to compare the good leg with the bad leg to determine as to how much motion is actually taking place.